my name is Alexandra Hill, and today I'm going to talk about giving injections. So, injections are an essential part of the nursing profession, and since I'm currently in nursing school and I just learned how to do it, I figured I might as well spread my knowledge since giving injections is a daily job at clinical. So there are two main types of injections. There's IM injections, which are intramuscular, and sub-Q injections, which are subcutaneous. So some examples of some IM injections are like vaccines, like flu vaccine and all that, and pain medications like morphine, Demerol. And then examples of sub-Q are heparin, so an anticoagulant or a blood thinner, and insulin. Insulin is the main sub-Q one. So there's some landmarkings for each. So IM injections, there's about 3 main landmarks that you do. So your deltoid, that muscle up here, your glute or your butt, that's a pretty popular one in the hospital, and then on your leg, on your muscle there, they give it. That's more common in children and patients that can't really move. And then sub-Q injections, there are two main spots behind your arm and your tummy. So I guess we'll start with IMs, what makes them unique. So IM injections, the needles are 1 or 1.5 inches. This is a 1-inch one. So they need to be slightly longer than sub-Q ones, which are only 5/8 of an inch. They need to be longer because they need to get deeper into the muscle, hence the name intramuscular. And IM injections go in at a 90-degree angle, so they go in directly like that. Whereas sub-Q go in at a 45-degree angle. And also with IMs, something I forgot to mention, when you go in, you have to aspirate a bit, which means you basically just pull back a bit on the needle, and then just to make sure you haven't hit a blood vessel of some sort. And then you just continue on with your injection. So the technique to giving an injection, what you have to do is you hold it like a dart almost. Most people don't really realize that. Hold it like a dart and you go in fast, and then you push in your medication slowly. Such the medication, pushing it in should take about 3 seconds. Yeah, so when you give an IM injection, you usually get it from a vial such as this. And what you want to do first is you want to swab it so that it's just sterile or clean. So you swab it like that. And so you pull back the amount of fluid you want. So I want 2 mils of this vaccine. And then you put it into the vial, like so. And you want it in the middle of the rubber part that you inject, because then there's less chance of you bending the needle. So you hold it upside down, you hold it, and you pull back your 2 mils. I go slightly over, and you want to try and get all the air bubbles out. Yeah, so if you get some air bubbles, what I do is I take a pen, and I just flick them up. Like so. So you have your medication all drawn up, and you're ready to go. So for instructional purposes, Piggy is going to be my patient. So we're giving an IM injection, so you go in at 90 degrees. So again, you would swab the area for 30 seconds in a circular motion. And then you take it out, you hold it like a dart again, and you Z-track, which is you pull the skin to one side. And you inject it 90 degree, aspirate, no blood, and push through slowly. And then you take it out and you let go of the skin, and that causes the injection to not go in a straight line. It goes in kind of diagonally with the skin purposes, so when you let go, the skin comes over, so no like blood comes out or of the medication. And then sub-Q is the same thing, except you go in at a 45-degree angle. And when doing that, you pinch the skin up, the adipose tissue, or the fat tissue, I guess, and you push it up, and you go in at a 45-degree angle. And you do want to be careful not to poke yourself, because it has happened before. So you want to go in at an angle where you will not be actually hitting yourself. Yeah, so those are the main kinds of injections. Once you learn them, they're really straightforward and they're really quite easy to do on a daily basis. Yeah, so thank you very much for listening, and I hope you enjoyed it, and yeah.